What's up, y'all? Welcome back to my channel. I'm licensed clinical psychologist, Dr. Kristen Casey, and I talk all about psychology, mental health, and therapy. So welcome to future therapists and current therapists, because today we are talking all about that initial intake session. As a disclaimer, every single therapist has a different process and procedure for this. We're all trained differently. We all live in different geographical locations, different ethics codes, and a lot of times we work in different work settings. So an inpatient intake is going to look wildly different than an outpatient intake, even for a similar presenting concern. Today, I'll chat a little bit about my process and procedure, which again, kind of looks different for every single client if I really think about it. So I'm going to try to generalize as much as I possibly can and walk you through some of the nuances that I experience as a psychologist who does therapy, navigating an initial intake session. For purposes of this video, if I talk about any client examples, it's made up. These aren't based on real clients. This isn't real information. It's just for educational purposes. We don't want to violate HIPAA. Before we get into the initial intake, I want to walk us back. So every therapist is different. I conduct a 15-minute free phone consultation. And I don't charge clients for this because it is so hard to even just find a therapist who you vibe with, who you could afford, who can see you during the times that you want to be seen, who has your specialization in terms of working with your presenting concern. There's all of these barriers and hoops. So I don't want to create another hoop for people by charging people for a free consultation call if they're not even going to use me as their therapist. So let's talk about that 15-minute consultation call. So even before I go on the consultation call with the client or, call them for that consultation call, I will send them a questionnaire, really, a brief questionnaire about what do you want to get out of therapy? Any details to me are helpful, not only so that I could help the client when I'm working with them, but if I can't work with them, I want to provide them with an accurate referral. I want to provide them with a referral to someone who will know exactly how to treat these issues that I don't know how to treat. So I'll schedule that initial consultation call a couple of days out so that they have time to fill out that questionnaire. I've gotten to the habit now of, reminding clients through email or sending a reminder message through the portal to say, hey, complete your questionnaires, because sometimes it does get lost. So then right before the consultation call, I'll pull up what the client had written down. It only takes about 5 minutes just to look it through, and then I'll give them a call. And I'll say, hey, it's Dr. Kristen Casey. Is now still a good time for our consultation call? They'll say yes or no, reschedule or not. Then I'll just inform them about the whole process. I'll say, this is a 15-minute phone call for us to get to know each other and for you to ask any questions that you might have about me, the therapy process, what therapy looks like, if I could treat your issues. Any questions are questions. They're valid. And then I'll say something like, we also only have 15 minutes, 20 minutes to kind of work through this. So I'll try to answer as many as I possibly can. And based on their questionnaire, just say they have anxiety. Then they're trying to work on generalized anxiety disorder. And I might say, when did you first start to notice this anxiety happen for you? It's kind of like an opener so that they could describe how long it's been, the things that they've been experiencing, what anxiety looks like for them, because long-standing chronic anxiety, in my mind, I treat it differently than acute anxiety based on situations or circumstances that are in real time. So the client describes all that stuff. We'll go back and forth a bit. I'll ask a little more clarifying questions like, okay, so would you say the anxiety is more physical? Is it more cognitive? Is it more emotional? Like, where do you feel it in your body or your mind, or how does it impact your life? Then I always ask, no matter what, I say, have you seen a therapist for this specific concern before? Because I don't want therapy to be redundant. I also want to be sure that the treatment that I'm going to provide isn't a treatment that they've either already done or that they've tried and they didn't like. And again, I'm not saying this to the client. I'm just sharing with you what I'm thinking. And then just say they talk about their anxiety and you get a really good idea about what it looks like. And in your mind, you're like, okay, I could probably treat this. Then I say, what questions do you have for me? I don't say, do you have any questions? Because it's like, that's a yes or no. I actually like to ask that open-ended of what questions do you have? Because then it kind of not forces the client, but it lets them know that I am here to answer any questions. Like I created time for it. I'm here. And if they say, oh, I don't really have any, that's fine. Then after that, what I do is I talk about the therapy process. I'll say, thanks so much for describing all of that. It sounds like these issues are within my wheelhouse. So I'm going to give you a little bit of an idea of how therapy works with me, because every therapist is so different. And then at the end of this call, I usually give clients 2 options. The first option is we could schedule an intake now, or I usually give people 2 weeks to think about it. If I don't hear from you within those 2 weeks, I'll assume now's not a good time for therapy, or I'm not the therapist for you, which is no big deal. You have to find the therapist that's right for you. If those 2 options don't work and maybe the vibe doesn't check out, tell me and I could provide you with a referral. You want to give clients some options so they don't feel stuck. This isn't a sales pitch. This isn't you selling your services. This is you assessing for fit. So just say they say, okay, great, sounds good. Then I'll say something like, okay, so therapy with me, we have this initial consultation call. If the vibe checks out both ways and I could definitely treat your issues, then we schedule an intake, or you take 2 weeks and think about it. And then we meet for that initial intake. That initial intake is an extension of today. It's an extension of a get to know you. You'll fill out an even more lengthy questionnaire, which I know people love paperwork. They love electronic paperwork, but it's so helpful because the more information that I have about you, the better that I could help you. And I know this is very vulnerable, sharing your entire life with someone. I could say that this is a safe space, but it's up to you to decide if I'm safe or not and what you're willing to share in that questionnaire. So then we're in the intake. Just say, pretend we're a couple weeks in advance, we're in the intake. The intake is 15 minutes. The first 5 minutes are reserved for us to talk about limits to confidentiality, some process and procedure oriented stuff, administrative stuff, fees, billing, all that stuff. And then we get to dive in. And that's where the fun begins. So then we dive in and I tell the clients, do not worry about preparing anything. Don't worry about figuring out how to say certain things. All you have to do is show up. All you have to do is show up with one thing in mind. What am I hoping to get out of the therapy? And you might not know that right now, and that's okay. I just want to prime you for that intake. And then during the intake, we talk all about their issues. Then towards the end, we collaborate on treatment goals. And treatment goals are like a blueprint for what therapy is going to look like for us. And that might change here and there. We might take some things away. We might add some things depending on what we're working with. But overall, we need a blueprint. We need to know where we're going and we need to know how to get our goals achieved. And these goals have to be objective. We have to know exactly what we're looking for so we know we have our eye on the prize and we know exactly what it means for you to feel better. What does it mean to feel better? What does it mean to achieve a therapy goal? What does it mean to have less anxiety? So we're going to objectify all of those things and make them measurable so that we know what we're striving for. And then I inform them about what therapy will actually look like. So then I say, again, I'm generalizing here based on whatever client is in front of me, and I'll say something like, just say the intake is done. Intake is solid. We got all our therapy goals. If you consent to it, I provide my clients with secure messages through our HIPAA compliant portal. And usually I provide takeaways. What did we talk about today? Because think about it, right? Just for a minute, take yourself out of therapist mode and put yourself in client mode. If you have a therapy session and then you go right to work, or you have a therapy session, then you have like your day get ahead of you, you're going to remember the therapy session. But sometimes it's going to be hard to know, okay, what was the actual focus of what I need to work on in between now and next session? It's not necessarily homework, but it's kind of like a reflection. There could be action steps in there, of course. So if they consent to that, I always send them that. So I do let them know intermittently I might type a little bit during our session, just so that if you're saying things and I'm saying things and I come up with an idea of maybe how you could handle this in between sessions that I don't want to forget. And I'll send that to you after session. In terms of therapy in general, intake's done, then we meet for our first 45-minute psychotherapy session. Again, 45 minutes isn't for everybody. Some people do 60-minute, 50-minute, 55-minute, just depends on you. For me, 45 minutes is the only thing that works for me. I worked in primary care doing 30-minute appointments and in DBT doing 90-minute appointments. So it just depends. DBT facilitator group, by the way. It wasn't individual sessions. So I'll say during that 45-minute psychotherapy session, the first 2 minutes are a check-in, a pulse check, a vibe check. How are you? What's the mood? Where's our mind at? Are we in a good headspace? Are we feeling a little low today? Like, where are we? And then we come up with ideas of what to focus on. It could be based on the session before, but if it's the first therapy session, it's new. So I tell the client, just show up. Don't worry about anything. Just show up. All you have to do is show up and let me show up for you. We come up with some ideas from that questionnaire to talk about. Hey, you talked about anxiety and how it really impacts your life. Let's really talk about what it looks like. Let's talk about what it feels like. Let's describe it. Let's go into detail. So as you could tell, the consultation call, the intake, and then the therapy session kind of flow in this linear fashion where it gets deeper and deeper each time. And that's kind of how therapy works. So I explain that to them. And then I explain at the end of every session, I'll always give you a take-home point, like a takeaway. Whether or not you take me up on that, that's totally up to you. There's no requirements to do homework in between sessions. I do think it's helpful to be introspective and reflective about therapy, meaning what hit, what didn't hit, what was helpful, what was unhelpful, all that stuff. And how can I think about my anxiety in a different way? After explaining all of that, I also let them know I'm not for everybody and everybody isn't for us sort of thing. So, I am on social media. I do have a media presence, and I do let clients know that right off the jump, especially if they only find me on Psychology Today. And I'll say I do make mental health content. The reason for that is to reduce the mental health stigma. Sometimes I do share personal things on there, but I only share things on there that I would be comfortable with my clients knowing about me. So if there's anything that's uncomfortable or anything that's off limits, I never share those things. So you won't find out things about me that I don't want you to know. That being said, this is a therapy relationship, and if you find me on socials, this is all my informed consent procedure, by the way. If you find me on socials, I can't respond to you on there. We can't do therapy through DM or comments and stuff like that. And if it becomes a problem, we'll have to terminate therapy. So I kindly ask that you don't out me as your therapist on social media and share something and say, this is my therapist. Again, I'm not for everybody. And then I tell the client throughout those therapy sessions, every couple of weeks or every couple of months, I'm going to check in with you. How is therapy going? What is sitting well? What is not sitting well? If you had to pick one thing, even if it's not terrible, one thing that you do not like about therapy and how we're conducting things, what would it be? What would it be? Let's collaborate. And I never take this personally, ever, because every client is so wildly different. I can't picture myself personalizing feedback from a client like that, because they're just sharing with me what works for them. It is what it is. And if I'm not for that client, then they know, okay, I could easily just tell Kristen, like, hey, this isn't working for me. Before we jump into the intake, I get a ton of questions about my intake paperwork. So I just wanted to delineate all the things that are included in there before you see your client for the first intake session. In my mind, paperwork, informed consent procedures, them knowing what they're getting into is even more important than the actual intake. They need to know what they're signing up for. Just from an ethical and legal standpoint, if you're going to engage in a treatment, you want to know the risks and benefits. You want to know exactly what the outcomes might be, good and bad, really. We want to think that therapy is going to be helpful for everybody. It's not helpful for everybody. It's just not. We have to be okay with that. I made a Word doc of all the things that I put in my therapy sessions. Okay. So we have... Sorry, I'm looking. Okay. So we have informed consent forms, including policies and procedures. If you're on social media, you'll want to have a disclaimer in there about social media as well. Like I talked about before, like, hey, I'm on socials. The e-paperwork includes informed consent forms, including policies and procedures. So the risks, the outcomes, the benefits of psychotherapy, telehealth, how to navigate telehealth, fees, if we go to court, if something happens, if we get subpoenaed, like all the stuff that people don't love to talk about, suicide, death, if you die, if I die, all that stuff has to be in there. I know nobody loves talking about these things, but it's so important. I always tell the client too, download this form and keep it, refer to it. If something isn't sitting right with therapy, just go through there and just look at it or just ask me. But I really like clients to be very informed and collaborative in the therapy process, because then they could be informed about what therapy feels like, what it looks like, and all of that stuff just from a legal standpoint, because I think that a lot of people think therapy is just us talking or me listening, and that's not what it is. If that's what it was, I don't even know. I don't even know how that would look. And then I give them that really, really, really lengthy intake questionnaire, which, again, not every therapist does this. Sometimes they go over that questionnaire in the intake, and that takes all that time. In my opinion, what's worked best for me is to have that information about the client, because then I just want to focus on the things that they want to talk about and the things that they want to get out of therapy. If I'm asking about substance use and just say they've never had a drink in their whole life, that's easy to just put in a questionnaire, ask them, and then just refer to it. Hey, looks like you hit no for any substance use abuse issues. Is that right? And then they'll say yes or no. It's so much quicker. But if you notice in there something about suicide or self-harm, or, I have a tendency to distract myself when I have anxiety, all those things you want to know. And then you could talk about those in the intake instead of asking the questions back and forth, because in my mind, therapy is an experience. And when you're able to be involved in the experience and you feel like it's collaborative and you feel like you're the main character as the client, not the therapist, and you feel like, okay, this person's really focusing on me and not doing paperwork, the flow just flows a little easier for me personally and the client. So we do the intake paperwork. I read it through. I make some notes right before I see them about what's really important and what, might not be important. If you have an intact family and there's no issues and there's no stress from that, great. We don't really have to focus on family stuff, but it's good to know. A lot of the questions in that intake form are about symptoms, history, medical stuff, anything that I should be aware of in terms of medical conditions. We are through telehealth. If I notice somebody getting really pale or I notice somebody kind of slurring their words, I want to know if they have any medical concerns so I could look out for those. And I don't know if it's me being a prior EMT or maybe it's just all psychologists are trained this way. The medical stuff is really important to know. Even if you just focus on mental health, just say they had some labs come back and their cholesterol was really high or something was kind of out of whack. Not that you want to see the labs because you can't interpret them, but you just want to know, hey, are you dealing with any medical issues? Are you working on anything? Do you take any supplements on a regular basis? Anything like that is helpful to know. Other questions in there include, have you been to therapy before? That is one that I always ask, I always focus on, and I always ask more about, because here's the key. If they've been to therapy before and it was a horrible experience, what about it made it horrible? We're not talking shit on your old therapist by any means. In my mind, most therapists are doing their best. What didn't work? What were you hoping was different? What were you hoping was different in that circumstance? What was helpful? Tell me the things that were helpful. I need to know. I would love to know. And some people have had really great therapy experiences. And I always say, regardless of whatever therapy experience you had, you already have a solid foundation that we could work on, work from. It's not like we're starting from ground zero. You've been in therapy before, so you're not necessarily starting all over. You're starting all over with me, but you're not really starting all over in therapy. So let's dive in and learn more about what that therapy process was like for you so that it's not redundant. Because the last thing you want is to, picture this, go to a meeting and it's one meeting and you get all the information, and then you are required to go to another meeting and it's the exact same information. It's like, this could have been an email. Why'd I waste my time? So again, therapy is an experience. In my mind, the key is to incite engagement. You want people to be very engaged in their healing journey. It's not just me telling the client what to do. It's really the client coming up with those conclusions, and me, I'm kind of a facilitator, like we're walking side by side with each other. In that questionnaire, I also ask a lot about preferences, spiritual, religious, how you identify in terms of race, ethnicity, gender and sexual orientation, pronouns. I noticed in the intake form, your pronouns are she, her, and I just want to confirm yours are she, her, mine are she, her as well, just so you know. It's, again, collaborative. Just say they have a name in there and they put a nickname. What would you like to be called? What would you like your notes to have? You might not care about these notes, or you might never see them, or if you do see them and you do request your records, I would love for it to be inclusive. What name would you like me to put in there? So again, this intake and the questionnaire itself is so important in my opinion. Okay, so that's the intake questionnaire form. I also send questionnaires based on presenting concerns. So if a client comes to me and they're dealing with crippling anxiety, I might send them the GAD-7 earlier with the paperwork so that we could get a baseline measure. And then, every couple of weeks or every week, we do the GAD-7 again and just kind of see the trend. Hopefully it goes down. I don't know why it went up. Hopefully it goes down. This video is sponsored. This video is sponsored by Jane, an all-in-one practice management software that can help you manage your practice, and it comes with a whole suite of features that makes it easy to meet with individuals, couples, families, and more. Most of us are already using a practice management software. Jane has an imports team, which we kindly refer to as the underrated data ninjas, and they help make the transition from your previous software to Jane smooth, seamless, and simple. You can even reach out to customer service beforehand to ensure that they're able to export your data. On the day of your import, you'll export your data from your previous software and upload it to Jane. Imports usually take 24 to 48 hours. And if anything comes up, the imports team, those data ninjas, will reach out to you right away. Really, all you have to do is work on the exports process, and then Jane's team takes it from there. You can learn more about Jane here and use code DrCasey2Mo for a 2-month grace period on your new Jane account. Thanks for watching. Okay, so now you're probably thinking, what do you do in this intake? If all of this information is happening before and you have all the information, what's the point of the intake? Well, again, therapy is an experience. So it's all about rapport, creating a safe space, and really ensuring that the client knows exactly what they're getting into, they know exactly what we're focusing on, and they feel just as confident about therapy as I do. And you'd be surprised, just asking open-ended questions, how quickly that intake goes. So for example, I have a lot of clients come to me with relationship issues. So I might say, walk me through your first relationship and what it was like. The first big one, the first notable one. What was it like? What did it feel like? What happened? Was it great? Was it fun? Was it bad? What happened? You want to get a timeline, because think about it. You don't know the client at all. They have all the information and you're trying to get that information right from them. And at the end of the day, you could get that information, but that client is just sitting there in the intake like, okay, I just gave all this information, So for me, the intake is an intake for information gathering, assessment. We want to come up with a diagnosis. We want to do all of the therapy things. We also want this to be an introduction into that first therapy session. So everything that you talk about in the intake, you're likely going to continue to talk about in that first session. So if you have any questions or outstanding concerns or thoughts, you want to at least share that and vice versa with the client. So if nothing else, if you're struggling in the intake and just say you're not going to do like the whole traditional, like ask them questions and they respond in the actual intake, you want to get a timeline of things. When did this start? What's the duration like? What's the intensity like? What's the frequency like? How's it changed over time? How's your anxiety impacted your life, your relationships, all this stuff? And then the second half of the intake, truly, in my opinion, is a collaboration on goals. Okay, so you said that your anxiety affects you in this way. or in these ways. It impacts your relationship. It impacts your ability to show up to work. It impacts your ability to really get your mind right before bed. What are you hoping to change? And then they'll list things. And even, to be honest with you, before that, I might say, what have you already tried? What have you tried? What's working and what is not working? And let's walk through. And just say they say, hey, I've tried scheduled worry time for my anxiety, and for some reason it just isn't hitting. Like I still kind of feel like it's not working. I'll ask them to describe exactly what they do. They might be missing a step or two. Who knows? Or not. Maybe they're trying it and just this method, which I'm pretty sure it's based on like a CBT perspective, just doesn't work for them. So we might kind of lean into more mindfulness-based strategies or something else. Again, the intake really is gathering more information, collaborating on treatment goals, establishing rapport, establishing trust and safety, getting as much information as possible, diagnosing, writing your progress note, figuring out if this client is definitely going to work for you, figuring out if this client really wants to work with you. All those things are happening, right? In the midst of that, really, if you're a new therapist, the key to focus on is it's not really about the information that you gather as much as it is the feeling and the vibe that the client has with you. This is their first time meeting you, the first time that you're meeting them. And if you're getting a sense that maybe they feel uncomfortable or something's not right, you kind of want to talk about that. You kind of want to say, hey, I know sometimes for people, therapy is uncomfortable, intake is uncomfortable. Walk me through how you're feeling right now. I know we're like 30 minutes in, just want to check in. What's up? What's going on? And they might say like, no, this is just overwhelming. I don't like talking about myself. Or they might also say something like, I feel like therapy is a waste of time. I feel like, I really hope this works. And then you could walk through all of those concerns. Again, when you create that open space and you really ask clients about what they're feeling, even if it's in the intake, that's kind of the place for it. Because if you wait until session 6 to ask, is therapy going, or do you have any concerns? Well, there was 6 sessions worth of stuff that the client probably could have said to you, but maybe they feel uneasy. There is a power differential. Then towards the end of the intake, I know I'm jumping all over the place. I just don't know how else to put this in words because every client is so different. Towards the end of the intake, I'll say, just say there's 10 minutes left and we have to schedule and stuff like that. I'll say, we're getting close to time. Walk me through how you're feeling. Walk me through your thoughts. Walk me through the questions that you have. Walk me through the thoughts that you might be thinking about all day, but you're afraid to say to me, if possible, if you feel comfortable, anything like that, to kind of let them know like, hey, I see you. I really, really, really see you here. And I know it's uncomfortable. I know it's stressful. And just say they're like, no, this was great. Things were peachy. I feel cool. Thanks for the cry sesh, whatever it is. I'll say, okay, let's come up with our next time to meet. What days and times work for you, whatever. Then you want to get them on like a weekly or biweekly or whatever basis. And then you go from there. But I always give my clients the opportunity to secure message me if anything doesn't sit well after session 2. So I'll say, hey, take some time, digest all this. If anything is not sitting well, or you have questions about anything, or anything is unclear, please message me. I tell them it's part of their session fee because I don't want people to feel like they're bothering me. And I'll say, if I'm in a session, I'm 100% in, so I can't respond. But in between sessions, I do have that 15 minutes because our sessions are only 45 minutes. So that's my time to respond and have admin time. So feel free to reach out whenever. And then that's how it goes. I know we jumped around a lot in this video, and I think it speaks volumes to the fact that no intake is the same. There's so much information. There's so much going on. And I think for therapists, we do feel a lot of pressure in that intake. I know when I was a really new therapist, I was like, oh my God, I'm not going to get all this information in. How am I going to come up with a diagnosis session 1? Depending on where you work, you might not have to. But one thing to consider is all of that clinical stuff aside, just us together right here, 2 therapists, you're doing your best. Take some deep breaths. There's going to be silence. There's going to be awkward experiences. There's gnats in here. I don't know why. There's going to be awkward experiences. There's going to be like weird moments. There's going to be cringe moments that you're like, oh God, why'd I say that? Especially in the intake. It happens to all of us. So if you're a newer therapist, especially, like no intake is ever going to look the same. And you're not always going to be for every client, and that's okay. And not every client is for you. I really like talking about this a lot because I think that we just think that we could treat everybody, and we actually can't. Like, we don't know every presenting concern. And sometimes there are personality dynamics that get in the way. There are personality dynamics that, for some reason, this client just doesn't like you. There could be countertransfer, or there could be transference. Maybe you remind that client of their mom or their dad or their brother, who knows? Or there could be countertransference, which I want to take some time and talk about that too. If you are dealing with something currently in your life, and that client is also currently dealing with something, or that client reminds you of something that you've been dealing with, that's hard. It's not that you're an ineffective therapist. That's just straight up hard. It is. For example, right now I'm dealing with a ton of grief. A ton. It's crippling. If clients tell me, oh, I just lost someone, this is really hard for me, I want to be there for them. And I also know that I'm going to have to regulate a lot after those sessions. So for me, I have a privilege of working in private practice. I have an hour or two after each client or something like that, or a half hour that I could like debrief and kind of go back into it. If I was working in community mental health or if I was still at the VA, that would be really hard for me because I would have no regulation time. Would that be good for me? No. Would it be good for them? Probably not, because I can't be objective, right? I would not be able to be objective. Really important to communicate that to clients, especially if you know right off the jump in the consultation call or in the intake. Things happen throughout life when you see clients for a while, right? Like just say you've lost your mom and then this client lost their mom. It's like, oh shit, here we both are grieving. Is it necessarily a bad thing and you can't be that therapist for that client? No. I mean, everybody works through things so differently. Maybe it's actually helpful for you as a therapist to help this client through the loss of their mother. Everybody's different. All that to say, just check in with yourself and you're doing your best. Send this to your friends. Send this to a friend who's a therapist who needs some ideas for their intake. And tell me if you're a therapist out there and you have an intake procedure that's different than mine. I want to know and I want to learn. So hit me in the comments. I tweak my intake procedure so often because of people commenting and talking with other colleagues. So I will see you next time.